We are joining in 2025. We are trying to have the global pandemic as a distant memory for us all. But if we try to just set the context in terms of some of the key lessons that have been learned, I know that you're keen to talk about digital health implications. So please do, with our esteemed audience, give us an insight in terms of Brunei and some of the key lessons learned during the pandemic that you are still seeing being applied today.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning. First of all, I'd like to thank the organizing committee, especially the UAE government, for this invitation. And Brunei is very proud to share its journey in healthcare. As you know, COVID-19 has leapfrogged many countries towards digitalization of their healthcare. And Brunei is blessed in such a way that for more than 11 years now, we have digitalized our health information system. But to move further, it's very difficult to convince our colleague from the Ministry of Finance to say whatever money we put in is investment. And alhamdulillah, good or not, COVID-19 happens. With a Brunei small population, we are limited with human capacity. So how do we control the COVID-19 pandemic? To ensure the movement of people is still going on, but yet we're able to control the pandemic. So we envisage by having this digital health information on the phone. Almost everyone in Brunei have a phone, whether you're a 60-year-old grandmother or 5-year-old, all right? So we take this opportunity to install this program called Bru Health, where it controls the movement of the people through using the QR code, so we can do contact tracing and vaccination program as well. So all done, and alhamdulillah, we managed to control COVID-19. Now, how do we move forward? So with the advantage that we have where people, almost everyone use this app to move around. And so we take this opportunity to make this contact tracing into become almost like your personal assistant to health, okay? So if you imagine in the days where you watch Star Trek, you just make sure your health is on your fingertips. So everything is on the phone now, okay? From your medical history, your appointments, and now we're going for public health, we're going for screening now. Make sure it's easily accessed, and in terms of health initiatives as well among diabetics. So there's like a coach for you, okay, to remind you what to do, what exercise you do. So the opportunities are tremendous. I think sky is the limit. So what we envision in future, that healthcare is literally at your fingertips. So that's how we want to move forward.
And so that's really interesting, Minister. You've already given us so many interesting points for us to delve into, that during the pandemic, you were able to roll out digital health, the Blue Health, and to this day, you're still seeing the benefits of that. If I may bring in the Minister of Madagascar, Public Health, Your Excellency Zely. Of course, what the pandemic also exposed for all of us was health disparities. They remain and they will continue into the future unless we all act. I'd like to hear your thoughts and perspectives on this, please.
First of all, thank you for your Highnesses, your Excellencies, and distinguished host for hosting this prestigious event. It's the first time I'm coming here in Dubai, assisting WJS, and it's a wonderful experience. For Madagascar, our president, His Excellency Randriamanantany, is one of the leaders of digitalization in Africa, in less developed countries, I think. In fact, it was an occasion for us to experiment a digital surveillance. We developed an application called COVID Data during the pandemic, and in fact it was the first time that we were tracking the spread of the virus in the two main towns of Madagascar, Antananarivo and to a mass in order to stop the spread of the virus, and we succeeded in it. And in fact, as it was the first experience, it was a success. And in fact, we are now implementing a national wide surveillance. We have more than 3,000 healthcare facilities across the island. And in fact, we bought tablets for all of these healthcare facilities, and now we are starting a nationwide surveillance in Madagascar. We are now starting also digitalization of the health structure, and electronic medical data is not used mainly in Madagascar, but we have to start somewhere, and the pandemic was an occasion for us to start it.
And so that builds on what we were hearing from the Minister of Brunei, speaking about digitalization and democratizing access to healthcare. And health disparities were, of course, I imagine, at the forefront of your mind during that time. So very interesting to hear from yourself there, Your Excellency. Your Excellency Peggy, welcome back, Minister of Health for Seychelles. So welcome back to the stage. We were on stage last year for the Global Health Forum. Always wonderful to see you here with us, and to welcome our new friends here as well. With yourself, Your Excellency, we can very much talk about lessons learned from the pandemic. And I know that you're also keen to really highlight the workforce crisis that is on the upscale across the world. So it'd be wonderful for you to share your insights in terms of this.
Thank you very much, Amanda. Your Highnesses, Excellencies, distinguished guests, it is indeed a pleasure to be here this morning. Well, when we look at health workforce, WHO estimates a projected shortfall of about 10 million health workers by 2030. And this would be primarily in low-income countries and in small island states such as my own. And therefore, we can see that there is a real health workforce crisis. What is causing this? It's caused by the need for health, all over the world, expanding health services, additional diseases and burden of diseases rising, aging population, the list is long. But we've also seen that there is the element of migration of health workers. And this is mainly from low-income countries to high-income countries who can provide better remuneration packages. Grass is always green on the other side. And therefore, we have to also respect the need of workers to live and work where they wish to. And that's important. Therefore, the crisis needs to be addressed. We cannot allow the crisis to overwhelm health systems globally, and more so in developing countries. And addressing this crisis, I believe, requires a multi-pronged approach. No country on its own can tackle it. We can do things at local level to improve the number of health workforce, but we cannot address the global crisis. I believe that all countries need to really have strategies to work towards self-sufficiency, and we need here to ensure that we have strengthened health systems, especially in source countries, and we need to invest in health worker education and training. We need to improve the working conditions, making it more conducive for workers to continue working in that sector. We certainly need to look at strong retention strategies. We also need to look at the pattern of health worker migration, because this is becoming more complex as we move along, and take the necessary information that we gather from there so that we can better manage migration, better look at what we can have as circular migration, as well as look at how international recruitment of health workers is done. I believe that we have tools available at the moment, such as the WHO Code and the Commonwealth Code of Practice for international recruitment, so that source countries are not depleted of their health workforce. We also, as we move on, need to look at international as well as regional strategies that will complement the national strategies to look at training and sharing training opportunities and exchange of health workforce, because that's important. The other thing is looking at the health workforce itself. Is that the kind of health workforce we require in each country? Is there a need for reprofiling, relooking at addressing the skills mix required at national level? And this is important so that we have examples of where tax shifting has helped, community health workers have helped, but we need to embrace, as it's been said here, technology. Look at how health is delivered, the use of technology in health, the use of AI as we move on to provide health. And health workforce should also be a responsibility of the private sector, so that training is not only from public, but also within private as well. And we need to mobilize international resources to ensure that low-income countries and seed countries put in retention strategies, put in the strategies required that we need to improve health workforce, both in terms of training, increased numbers, but also retention. And above all, we've had migration, so we have a large group of diaspora out there. So the use of diaspora to improve our health systems in source countries and look at return migration, making this attractive so that we can have the skills that have left our countries come back to contribute. Thank you.
I think there's a really fascinating and interesting points you make. They're very astute points, and they speak really to the heart of the Global Health Forum. You outlined there the movement of people, which is very inevitable across the world, but what are the repercussions and what are the implications? Workforce challenges, retention, training, some really astute points. I'm sure we can unpack them further as this panel discussion continues. I'm going to bring in Her Excellency Aminath Shirna. You are the Minister of State for the Maldives. Now, in certain geographies of the world, there's certain challenges that are being faced. We're going to come on to climate-related challenges in a moment, but I want you to build on what Her Excellency Peggy mentioned there in terms of health disparities. If we can speak about this idea of what has happened during the COVID-19 health disparities, which really links into workforce challenges as well. So if we can go in this direction with yourself first.
Yeah. Bismillahirrahmanirrahim. Honorable panelists, distinguished guests, ladies and gentlemen. First, I would like to extend my sincere gratitude to WGS for providing the Maldives with this opportunity to present our vision for the future of the health care. Going back to the question, the COVID-19 pandemic exposed a significant healthcare disparities, particularly in the remote island communities among the vulnerable population. The Maldives remains committed to the closing healthcare gaps through the strategic investment and policy reforms. Here, I will highlight the 4 important points. First, we are strengthening the primary healthcare by expanding the services in the outer islands and establishing urban primary healthcare centers to improve the access to reduce the pressure on the hospitals. Second is the emergency referrals. Recognizing the geographical challenges of emergency referrals, we have prioritized strengthening the emergency medical services with the introduction of air ambulance services, ensuring that all the urgent cases receive timely medical attention. Then the free medical checkup. To ensure the equitable access of care, we have introduced free medical checkup for every citizen covered under a comprehensive social health insurance scheme. And last, revising the migrant medical checkup. For that, we have revised the migrant medical checkup to improve early detection and healthcare access for this vulnerable group.
Thank you so much, Your Excellency, for your insights there. Again, some really urgent issues that do need to be addressed when we speak about health disparities, building on the focus on the workforce crisis as well there, and providing equitable healthcare, which I know is going to be echoed throughout this panel discussion. Dr. Amer Sharif, President of the Mohammed bin Rashid University of Medicine and Health Sciences here in the UAE. For yourself and myself, UAE is our home. So it would be wonderful for us to give our international and esteemed audience an insight in terms of how the UAE is providing a blueprint, some of the health solutions that are occurring here. But also, I invite you to build on the points that our speakers have made in terms of certainly healthcare disparities and retention and training when it comes to workforce professionals.
First of all, thank you very much to the World Government Summit for hosting me today with such a distinguished panel of speakers. And I will welcome you also to the United Arab Emirates. And some of the colleagues here have also visited us. So thank you very much for visiting our health system. I really appreciate that. And I'm truly humbled to be representing the United Arab Emirates in the presence of healthcare leaders, colleagues, and educators. And so I hope I could represent what we do here at its best. I think the story of COVID, it's a true story of collaboration. It's a true story of the whole community coming together. And here in the United Arab Emirates, we witnessed that. The leadership made sure from day one that the guiding principle is a balance between lives and livelihoods. And we were guided by their vision, by their foresight, to make sure that all efforts are integrated to the well-being of everyone living on this country. And I think with every challenge comes an opportunity. So the leadership gave us an opportunity to think of how can we improve further our healthcare system. Although the United Arab Emirates is a young country, yet in 2000, WHO ranked many systems around the world, and we were amongst the top 30 in the world in those days. So I think in Dubai, we came up with a model where if you want to transform the government healthcare system, you can transform it to an integrated academic health system where it's a system that's led by research, by evidence-based approach, and hence the establishment of the first integrated academic health system called Dubai Health, where it's a combination of all government hospital and healthcare centers, an academic institution, the Mohammd bin Rashid University of Medicine and Health Sciences, and a philanthropic organization, all with a vision of together we advance health for humanity and serving to impact lives and shaping the future of health. So I think as a prototype or as a model, I think that's what we would like to share with our colleagues in other cities and around the world. And I think that this will be an ecosystem that will attract talent, that will develop talent, and it will also lead life sciences and medicine to the betterment of humanity.
Now, Dr. Amer, I knew that you'd be wonderful to set the context for us in terms of what's happening in the UAE, what happened during the pandemic, and what's been brought forward to today as well. It'd be wonderful to get your insight. We have a very unique demographic here. When it comes to healthcare professionals, attracting, developing, training, and of course we're not only speaking about the 200 nationalities, but we are proudly here with our Emirati brothers and sisters and the talent that we have here in this country. What's being done here in the UAE? What could we learn?
Well, I think the power of this community is in its diversity, and having 200 nationalities, it's a powerful tool for us. And I think the cooperation of the whole community led to what was a successful outcome. And in terms of training and development and workforce requirements, I think in Dubai Health, having the Mohammd bin Rashid University integrated within the system has allowed us to develop programs leading to a sustainable workforce in the areas of medicine, nursing, and other health sciences, but also in the areas of healthcare administration. And I think we've recently launched the Dubai Health Leadership Academy, basically to instill the values and the competencies that are required to develop visionary leaders to deliver our promise of patient first. And I think it's about time for us to think of sustainable models for developing the workforce, for training future healthcare professionals equipped with technologies and AI, and other competencies that are required to lead healthcare systems.
Thank you so much for addressing my follow-up question, because I wanted to ensure that you patiently allowed me to come to you. And now that we've all set the scene and heard from you all, I really want to create a more conversational scenario, that we speak about some of the very urgent challenges and seek those solutions, as you talked about there. To bring yourself in, Dr. Isham Jaafar, the Minister of Health for Brunei, some of the issues that were addressed there in terms of workforce challenges. What's happening in Brunei? What can we learn from the model there?
Yeah, I think Brunei is no exception, especially with small populations. Human resources are always challenging. This is why technology, or AI in particular, can help us to complement the system. For example, in terms of screening, for example, like diabetic retinopathy, we have an AI system now where we can, anybody can use it. Anyone who can just on the computer can do the screening for us. In the old days, it has to be an optician or ophthalmologist. And they can only do about maybe 10 a day because of the eye drops that require dilatation of the eye, etc., and things like that. But now with this AI, we can do it in 5 minutes. And there's no need to put any eye drops in most cases. And because of that, you don't have to give, more importantly, medical certificate for that person. Because if you put an eye drop, they can't drive. So for private companies, this is a wonderful thing. So, you don't lose manpower for that day. And for the government point of view is that this easy access for screening will encourage more screening to be done, because diabetes is among of the highest NCDs in the country, and blindness is there, especially among the youngs. And when you ask them why you don't go for screening early, it's because of this troublesome of waiting in the queue and dilatation, an hour wait, and things like that. So we make AI to be a complement to the health force. So, but it's not that easy as well, because the moment we start doing AI, the healthcare force have some suspicion. Will I lose my job? Will I be retrenched? So these kind of educations need to be done, and to reinforce to them, no, there should be enablers for you so that we can do a better healthcare system, more resilient, especially now the ophthalmologists can concentrate at the actual eye problem rather than do the screening bits where everyone can do. So we make sure every individual specialist do what they're supposed to do. They don't do all these other things where it can be done by other things. The same thing with screening, for example, breast screening for mammography. It's always challenging to have 2 radiologists to read the mammography. So if you have AI to help as one of the reader, and the other is the actual radiologist, so it can dispense more radiologists to do this. We can do screening not only effectively, but more robust in terms of efficiency of timing, turnaround, and things like that. So, especially where human resource is a challenge, the use of technology can help to enable a better, resilient healthcare for that country. That's how I believe it to be.
Some really powerful points there, Your Excellency. Addressing the workforce challenges, we do need to think outside the box and see how AI could be an aid to the professionals in the healthcare system. You mentioned there AI complementing the workforce, but also acknowledging the reticence with healthcare professionals as well. So I think that's a really astute point to make. I'm going to bring in His Excellency Zely. When we speak about this intersection of technology and health and how digital health, can you give us an insight in the impact that you're seeing when it comes to Madagascar and the role of AI in your healthcare system?
In fact, we are now trying to implement IA in the whole system. It is interesting to go here and to see the advances we can have with IA, because it is possible now to detect a very early stage of the disease And the main goal of the health system is to improve the health of the whole population. So I think it is an occasion for all of us, for all countries who are present here, to think about the future, as the theme of this WJS is to think about the future. I think that we cannot go forward without aim. So we are part of it. Within the Ministry of Health, we are implementing a lead program in order to train people to fit with this EA to take care of the whole population.
I think that's really interesting. And again, with yourself representing Madagascar for us here, we've got such interesting, fascinating geographies and very distinct issues, but also universal themes that we are exploring. So this is why platforms like this are so powerful. I'm going to come to Your Excellency, Peggy. From last year's forum, we talked about the climate-related health challenges. It'd be wonderful to get your perspective on this. And then I want to open it up to all of our panelists to give us an insight in terms of what would be a main big call to action that you would urge our esteemed audience to take away from today in terms of the big health challenges that we have coming up and a solution. That's a big question, but maybe just one key call to action. But Her Excellency, Peggy, if you'd like to speak about climate-related health challenges.
Thank you, Amanda. Well, we really need to look at adapting healthcare systems to mitigate and respond to all the emerging climate-related health challenges, and these are many. And may I speak from the perspective of a small island state where, we know that seeds are most vulnerable to climate-related health challenges, and that's because of, our geographic location and different other issues which we face with climate change. And as we look at what needs to be done, we need to learn from lessons of maybe COVID-19, which taught us that resilience is not an optional, and that climate change amplifies this truth. We really need to be looking today as we gather to really look at reimagine healthcare in this era. We need to be looking at what we can do, whether we continue the way we were, and that's not an option, but what we do now to move healthcare into this sort of interconnected ecosystem. For many seeds, the answer is clear. We envisage a future where healthcare transcends borders, where we leverage technology as a force for equity and embed sustainability at its real core. Therefore, the actions that we need to take would be an integrated approach, and we need to strengthen our healthcare infrastructure, make them climate resilient. We really need to be looking at a multi-pronged approach, and but localized at the same time that blends the different technology that's available now, but ensuring that the policies speak to the problem and that we do have regional and international cooperation. We need to create if necessary, a global climate health information fund, which would scale up, these models and all looking at prioritizing the needs of seeds and nations where climate change is really having a lot of health challenges. We need to leverage the international climate funds, such as green climate funds, and channel some of this funding into health projects, especially to address the health-related climate health challenges. And we need a radical reset. And really, ladies and gentlemen, the pandemic for us was a dress rehearsal and for the climate crisis that we face right now. So let us take on the lessons learned. For seeds like us, the stakes are existential, but our vision is nearly always universal. And as we move on, what we look at the future of healthcare, it's not just about treating diseases. It's about healing our planet and its people. So let's choose radical collaboration over incrementalism so that we can address the health challenges of climate change.
I think that's a very empowering point, radical collaboration. That's going to be your call to action, Your Excellency. Thank you for that. Your Excellency, Aminath, because we are running out of time, but just a very short call to action. It can be related to what Her Excellency was saying about climate-related health challenges. And the next panel discussion is going to be building on what Her Excellency spoke about, their funding. We are going to delve into that. And then I'm going to allow all of our speakers just a very quick call to action. So, Your Excellency, Aminath.
Yeah, the Maldives is on the front line of the climate crisis, facing rising sea levels, extreme weather, and direct threats to our healthcare system. This is not just an environmental issue, it's a public health emergency. The healthcare system must adapt. Climate-driven risks like waterborne diseases, heat-related illness, and new infection threats are increasing. The question is, are we ready? In Maldives, we are strengthening the healthcare infrastructure to withstand the extreme weather, invest in the early warning system to detect the outbreaks, and also training the healthcare workforce to handle the climate-related challenges. But no country can do this alone, right? So we believe that we need support from the global.
Fantastic. No country can go alone. And Dr. Amer, we spoke earlier about this country representing the world. Your call to action.
Well, I think I would like to conclude with what His Excellency Minister Al-Awais said at the end of his speech, is to make medicine more humane. We go back to empathy and kindness and understanding in our profession. I think we've been speaking a lot about the technologies and the engineering. Those are important, but those are important to make sure that we demonstrate empathy and humanity in our profession. So I think that's really important. In addition, I think as health systems, and Her Excellency, the Minister, she mentioned that, is we need to be very innovative and adaptive as we develop. And I cannot emphasize enough the power of integration and collaboration. That's key for us to deliver what we're supposed to deliver to enhance the well-being and health of the people.
Absolutely. And it's great to have this echoing throughout our speakers, collaboration, and as you said, humanity, which echoes back to our opening with Tariq's very powerful personal story there, the humans at the center of this. Your Excellency Zely, and then I will end it with yourself, Your Excellency. Your call to action, a very quick call to action.
My call to action is for the medical tourism as a solution of the movement of the healthcare workforce from south to north. Thank you.
That's interesting, and it's a really fruitful way for us to think about future debates here, so medical tourism, and yourself, Your Excellency.
I think at the end of the day, is what we want to measure here is that health is a human right for everyone. So we make sure that as a government, we ensure the healthcare is sustainable and yet resilient, and make sure no one is left behind. So collaboration is very important. We need to learn from other countries how to make sure we can able to deliver the healthcare that we need without repeating the mistakes or things like that. So collaboration definitely is the key.
These are really impactful points that you've all kindly shared with us today. We promised you a high-caliber ministerial panel, healthcare leaders with us today in order to inspire us, in order to make sure that we focus on the urgent challenges, but seek the solutions as well, really building on what His Excellency Abdul Rahman set the scene for us earlier today. So thank you so much. My esteemed audience, please give my panelists a big round of applause.